Welcome back to our two-part series interview with Dr. John Thomas, a friend of mine who is a physical therapist. In this video, we're going to be talking about some of the limitations that patients come up against as they're trying to do their physical therapy. We talk about some strategies to overcome those limitations, and Dr. Thomas gives some of his top tips on how to get the most out of your physical therapy. Please watch and enjoy. Which is like, at what point do you start to say like, hey, this isn't working? Like, are there certain things you're looking out for? Or is it really true when patients are telling me like, hey, I tried physical therapy and it made me worse? Like, is that generally like them doing the exercises wrong, or do you feel that there really is a point where you're like, hey, this is not for physical therapy, we need something else?
Right. No, I think it's either maybe too aggressive from the physical therapist where we didn't dose the manual therapy or the strengthening exercises properly. That's one. Or maybe there's not follow through with the patient. That's two. Or maybe this person isn't a candidate and then they need to go back for further diagnostic work, or hey, maybe there's surgical intervention that needs to take place. But a lot of time I tell the patient, hey, if you're not feeling any better in the first week, then either I'm doing something wrong, I need to change the treatment plan, or we either need to do more of it or less of it. Worsening, like no change is the worst. If it's worsening, it's like, okay, we're on to something, but maybe our dosage is off.
Okay.
If it's helping, yes, keep going. It's almost like prescribing medication.
Yeah.
Oh, I
You're
think based on
titrating.
my experience,
Yeah.
I'm going to give this, but
Yeah.
oh, that didn't touch it, I'm going to increase the dose.
Right.
When there's no change, that's the worst for us.
Okay. I guess that makes sense because, I've been in surgery where we're looking at the bicep tendon, for example, and we see that there's like a hairy tendon with like half of the fibers torn. And you're like, you know what? This patient would have been spinning their wheels if they just kept on trying physical therapy. But for every one of those, I'm telling you, I see probably 10 that just look like they got some synovitis on the tendon. And I thought, maybe given enough time or maybe some better circulation, this thing could have healed. And so, speak to those situations where we have those patients and their tendon is really inflamed. Like, how is physical therapy going to decrease the inflammation in the tendon, or do you take a more indirect route of fixing the other problems like the mechanics, which will indirectly make the inflammation go down?
Right, right.
So, yeah,
I
what do you
think
think?
number one, tissue irritability level kind of drives treatment. So if they're just screaming, and I can barely move it because it's so lit, I will calm it down, whether it's gentle massage, whether it's laser therapy that helps decrease inflammation, some type of other modality, even a taping technique to unload it and support it. And then as things calm down, you kind of go a little bit after it more, because your physical examination is basically really limited if they're coming in with a hot shoulder.
Okay.
Number one is I just want to calm it down.
Okay.
And sometimes that's me giving you a call saying maybe they need an injection
Cortisone
or
shot, yeah.
something
Yeah.
to put this fire out, because
Okay.
then they're wasting their time coming because
Yeah.
I can't even do anything with them.
Okay, but assuming we get that fire put out,
Yes,
maybe
yes.
it took a cortisone shot, or
Right.
they just took some Tylenol,
Right.
or Aleve,
Yeah,
something
yeah,
like
yeah.
that. Now, what's your next move? Like, now we know just from past experience that tendon is inflamed. Like,
Yeah.
what are the things that you're going to do now to address that?
Now it goes back to what was the cause. Was it imbalance of strength, so they were always firing their bicep tendon instead of activating other muscles? Was it a postural issue where we need to correct? And I go back down to that route.
Okay.
Yeah.
So, assuming that it is more of a postural issue, like let's say that I've got a really tight a postural issue or something like that.
Right.
My shoulders are hunched forward. What are some of the things, like maybe give me an example of 2 or 3 things you might tell me that might help me get out of my bad posture?
Right. So in terms of an exercise, or maybe just a kind
Yeah.
of an awareness.
Yeah, or both, or
Okay.
whichever
An
one.
exercise, it might be something as simple as maybe even a little if they could do a self massage, or even like that ART that you were talking about.
Yeah.
So a lot of times if you're trying to lengthen a muscle, but there's tightness in there, you might be playing tug of war. So we try to reduce that tightness, whether it's a little massage or trigger point, or like that ART, that's basically active release, where you're tacking down that muscle while they're lengthening it.
Okay.
So teaching them how to maybe do that on their own to free it up.
Okay.
And then they can do like a doorway stretch, get into the doorway, open that up. And then I have them set a timer on, if they're on the computer a lot, every 20 minutes, reassess.
Okay.
Or, because it's easy, you start, gravity affects that. So something where they can have that alarm to, oh, you were able to do it 20 minutes and you were still in a good position, try to lengthen it to 40 minutes. Or, oh, set it for every 60 minutes. So now you're trying to retrain their movement pattern a little bit, or their posture.
Okay.
Make it become more habitual versus this is their natural, now we got to get them to a little more upright.
All right, so I think we've covered a lot of good material here, but I think maybe to summarize and to wrap things up, what are maybe the top 2 or 3 things that you could recommend to patients in order to make them, or to give them the best chance at making physical therapy successful?
Yeah, I think, and this is an example. So if I see a patient that I didn't do the initial evaluation on, but they maybe saw another physical therapist and I'm covering, or they get on my schedule. And I say, okay, introduce myself. And so what's your understanding of what's going on? If they can articulate to me, they say, hey, I have some biceps tendonitis. It's due to the way I'm sitting. I have some tightness in my pecs and my thoracic spine, some weakness in the muscles that help support the shoulder. So I'm working on getting that to unload that biceps tendon to prevent this from coming back. If they can articulate that, then that's huge, because then they understand what successful treatment plan looks like and what maybe is the cause of their symptoms and how to fix it. If they can't do that, then that's poor on us as physical therapists, because we need to educate the patient in terms of what the successful treatment plan looks like. That's my personal opinion.
Okay, so having a good understanding of what is their problem and what they're trying to fix.
Right, and then what maybe they want to get back to, because sometimes it's hard when you do have pain. You may not see some of the gains.
Okay.
But trying to be very, I guess, objective in terms of what's valuable to them. If they, like a simple thing, reaching behind my back, or washing my other shoulder. When they come in and we know that's a goal for them, or washing my hair, and we say, hey, how's that going? Because they might say, oh, it still hurts. And then, oh, well, actually, I'm able to reach a little bit further back. And I think trying to maybe make their focus on function and less on pain, because that's just, I think, good overall for retraining even the brain as well. Because it's easy to just get so fixated on pain and you forget the functional gains you might be getting.
Okay. And earlier you mentioned that a good physical therapist is going to really try to get to the root of the problem. Can you just maybe speak more about that as far as how that relates to a successful outcome?
Yeah.
Because I do think that having a good physical therapist makes a difference.
Yeah, so a quick story. Patient comes in and they have shoulder pain. And when they lift up their arms, the one shoulder goes higher. And I say, okay, well, look to the left, look to the right. They're stiff looking to the right. So if there's an issue with the rib cage or the neck, that can cause faulty mechanics in the shoulder. So then us as a physical therapist, maybe even being able to make a quick treatment. So I do some first rib mobs, and then I reassess. And the person says, whoa, my shoulder just went up further. So is that a tendonitis, or is that something coming from above? So that for us to, I think, treat and then retest, and then prove to the person that, whoa, this is I'm on the right path. I think that's huge. Or if we can reproduce their pain. If it hurts the bicep, we push on it. Oh yeah, that's my pain. Contract it. Oh yeah, that's my pain. Lengthen it. So then it's like, okay, how do we calm it down? And then how do we prevent it from coming back? Test and retest, that drives home that you're on the right treatment path.
So like an immediate response, like patients can actually see what happened as a result of their treatment.
Yeah, or when it's a strength issue and they'll say, ooh, it hurts, or they have a painful arc, and I manually support their shoulder, and they're like, whoa, that doesn't hurt at all.
Yeah.
Then that to me says, okay, you need to strengthen all those muscles that stabilize it.
Yeah.
So and then the person's blown away because they're like, oh my goodness, I just went far without pain, and you were basically supporting it. And then I say, well, that's what your muscles need to do. So then there's more buy-in to be compliant with the exercises.
Okay. And where can people find out more about you and the office?
Yeah, you can go to our website. It's LORPT.com, Laguna Orthopedic Physical Therapy.
Okay, great. Thanks a lot. And thank you
Thank
for
you.
coming on the
Yeah,
show. Really
thanks for having
appreciate it.
me.
Yeah, that was really valuable. And I hope you all learned something from this video. Definitely, if you liked the video, please hit the like button. And stay tuned for more videos on various shoulder and arm topics. For those, please hit the subscribe button. Thanks a lot, and see you on the next one.